Chapter 10, Pediatric and Geriatric Procedures. By the end of Chapter 10, you should be able to describe fears or concerns that children of various ages might have regarding the blood collection process. List suggestions for parents and healthcare workers during a venipuncture or skin puncture. Identify puncture sites for a heel stick on an infant and describe the procedure. Explain the special precautions and types of equipment needed to collect capillary blood gases. Describe the venipuncture sites for infants and young children. Discuss the types of equipment and supplies that must be used during skin puncture and venipuncture for infants and children. Describe the procedure for specimen collection for neonatal screening. Define 5 physical and/or emotional changes that are associated with the aging process. Describe how a healthcare worker should react to physical and emotional changes associated with older patients. Introduction. Collecting blood from a pediatric and/or geriatric patient requires much clinical knowledge about and training for the proper techniques. Both age groups require extra care in blood collection. Pediatric patients. Observe various techniques as they are performed by a healthcare worker experienced in pediatric phlebotomy. Practice the techniques to develop the necessary skills. Learn how to talk with children of various ages to calm them for a blood collection. Our younger multicultural generation. Preparing a child and a parent. A calm, confident approach is the first step. Correctly identify the patient. Hospitalized infants usually have an identification bracelet on his or her ankle. Newborns not yet named are usually identified by their last names and identification number. A child's past experience with blood collection. Develop a plan for a successful blood collection. Place yourself at the child's eye level to explain and demonstrate the procedure. Talking to a child should be at eye level. Preparing the child and parent. Establish guidelines with the child and parent. Be honest. Tell the truth. Tell the child that the procedure may be painful. Encourage parent involvement. Psychological response to needles and pain. Children between 1 and 2 years of age may react extremely to painless procedures such as taking a temperature. Children between 3 to 5 years old perceive pain as a punishment for bad behavior. Children between 6 to 12 are more likely to relate pain to past experiences. Children between 13 and 17 years are frequently embarrassed to show fear. Distraction techniques. Children over 3 years respond well to distraction techniques to help them cope and lessen distress. Examples of distraction are blowing bubbles or pinwheels, counting, reading a book or looking at a video, listening to music, singing, or talking in a gentle voice about something enjoyable. Room location. Best room location for a painful procedure is a treatment room away from the child's bed or playroom. If the child cannot be moved to a treatment room, maintain privacy by drawing a curtain between the beds and speaking in a calm, quiet manner. Equipment preparation for a friendlier environment. Use shorter needles if possible. Keep threatening-looking supplies like needles out of sight. Place goggles or face shields on after greeting the child. Let them see your face. Positions for restraining a child. Holding the child may be required to ensure that the child does not move his or her limb during the blood collection. Restraining techniques should be compassionate and safe and performed quickly. A supportive, properly instructed parent can assist with restraining while providing comfort to the child. Neonates and infants younger than 3 months usually do not require restraint and can be managed by the healthcare worker alone. Swaddling helps to control and comfort an upset newborn. Children may become combative, kicking and thrashing if force is used. If the risk of injury to the child or the healthcare worker is likely, discontinue the blood collection attempt and notify the nurse or physician. Decreasing the needle stick pain. EMLA. is a topical anesthetic. It is applied to the skin as a patch or a cream that is then covered with a transparent adhesive dressing. Optimal anesthesia occurs after 1 to 2 hours and may last as long as 2 to 3 hours. Do not use if the child is allergic to local anesthetics. Using EMLA. When a needle stick is planned, EMLA can be used to anesthetize the skin where the needle stick will occur. Apply a thick layer of the EMLA cream over the intact skin. Cover the cream with the transparent adhesive dressing for up to 60 or 120 minutes. Oral sucrose. A 25% solution of sucrose can be prepared by mixing 4 teaspoons of water with 1 teaspoon of sugar. Carefully administer by oral syringe, dropper, nipple, or on a pacifier. A sucrose nipple or pacifier is given 2 minutes before heel sticks. Its action lasts about 5 minutes. Collection of capillary blood for neonatal screening. Prepare and assemble supplies. Introduce yourself to the parents, explain the procedure, and use appropriate comfort techniques. Identify the infant properly. Fill out the information on the newborn screening card. Warm the site according to the institution's procedures. Wash or sanitize your hands with an alcohol hand rinse according to institutional policy, then put on gloves. If required, don a gown and a mask. Venipuncture on children. Used when larger quantities of blood are needed. The veins of the antecubital fossa or the forearm are the most accessible and are chosen for most toddlers and children. These are the veins in the arm. Venipuncture is indicated for blood sampling for routine laboratory tests, erythrocyte sedimentation rate, ESR, blood cultures, cross-matching, coagulation studies, and drug and ammonia levels. Procedure for performing venipuncture on children is similar to that of adults. See Chapter 8. Special considerations may include necessary preparation of the child and parent, assistance in restraining the child, use of special pediatric-sized needles or safety winged infusion sets.